Hello, everyone. Greetings for the day. I'm Sayukta from All About Skin Wellbeing, and I'm sure all of you must be really doing good. We all know taking good care of your skin is important for more than just the appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is very common on our skin, on nails, and many a times on scalp. Fungal infections are diseases caused by a fungus. Malfungal infection can look like a rash, it can be really itchy and annoying. So let's connect today with our skin expert, Dr. Ramya N, live from Bengaluru, to enlighten us on the topic of fungal infection. Dr. Ramya N is a board certified dermatologist and cosmetologist with 8+ years of experience in treating various skin, hair, and nail disorders. She has worked as a consultant in various teaching and corporate hospitals in Bengaluru. She has completed her post graduation degree from the prestigious Institute of Kempegowda Institute of Medical Sciences, KIMS Bangalore, and her fellowship in aesthetic medicine from the same institute. She has good diagnostic skills and extensive knowledge on the latest and the best practices in skincare, with which she aims to deliver effective treatment for the patients who approach her. Today, Dr. Ramya N will share with us on fungal infection. A very warm welcome to you, Doctor.
Thank you.
So, Doctor, as today we are going to talk about fungal infection, first of all, we would like to understand what is fungal infection, how it spreads, and which are the most common body parts where there are more chances or who are at risk of having fungal infection.
Okay, good afternoon, everyone. So it's nice to have this live session for today, and we'll be talking about fungal infection.
Doctor, please.
Yeah, so fungal infection is an infection caused by an organism that is a microorganism called as fungi. They are usually present everywhere in the environment, and they usually stays on the body on skin, but they usually cause infection when they invade the skin. So that happens when there is a decrease in the host immunity or environmental factor which is conducive for their growth or invasion in the body. That is when it leads to an infection. So, so they are present, as I told you, they are present everywhere, and not everybody is susceptible to have fungal infection. They can get only if they are, the environmental factors are favoring its growth, and also the body's host immunity is altered, so that can lead to fungal infection. And the most common infections that we see on the body are on the skin. It can be in the groin region or anywhere on the body. It has a specific name according to the sites that are having infections. Like if it happens on a scalp, it can be called as a tinea capitis. If it happens on anywhere else on the body, it can be tinea corporis. In the genital area or in and around it, it can be called as tinea cruris. On the nails, it can be called as onychomycosis. So it is given various names depending on the site, and these are the most common. And also sometimes it can cause internal infections that are called as a systemic fungal infections.
Right. So today we'll try to focus on the superficial, that is, infection, fungal infection of skin, nail, and scalp. Now, doctor, places where the humidity level is more high, or weathers where we experience a lot of humidity, people who sweat a lot, or people who dress up in a way where in folds and all there's not much of ventilation, so a lot of accumulation of sweat, moisture, etc. Do they act as a favorable environment, give it a favorable environment for the fungus to grow? And is it also one of the reasons we see a lot of cases or rapid increase in the cases of fungal infection when it's summers, or when the into these transition weathers where one weather is going, the other is coming, and there is this into between 15, 20 days, 1 month, where we experience a lot of sweat, etc. Are they favorable for those fungus to grow, and this is when we need to be more careful?
Yes, definitely. What you're asking is absolutely right. So, as I said, there are many factors which play for the fungus infection to happen, and one of the most important factors are environmental factors. By environmental factors, we mean it is the change in weather condition, where it is more of a humid and hot, humid conditions, which leads to increase in the perspiration a person can lead to increase in the fungal infection. So during those summer season and changing over to monsoon, where the it is very hot as well as very humid, leads to these fungal infections. So in places where humid conditions, like anywhere where the two folds of a body is enclosing, like in the armpit or in the groin region, where two thighs come in contact with together, where the moisture wicking or moisture is tend to be trapped in those areas are more prone for fungal infection. And also during that period you need to wear loose, airy and a moisture wicking cotton clothes, which helps in leading to increased ventilation in those areas. So yes, during those periods, like during summers and during rainy season, you should be really careful to prevent fungal infections. And yeah, so that is to answer environmental factors like the moisture and humidity and the way you clothes, all of that plays an important role for fungal infection.
Right. And as you said, it's important to prevent fungal infection, and especially for those
Yes.
who are prone to fungal infection and all, it's important to know what could be the preventive measures. Doctor, if you can shed some more light over that, how to prevent having fungal infection.
Yeah. So basically, it is first thing we go step by step. First is a clothing and hygiene. Clothing first, you have to use a very loose, airy, moisture-wicking clothes, cotton clothes, which are comfortable on the skin, and also your body hygiene that you should take bath every day so that there is no excessive fungal overgrowth or the sweat which tends to accumulate and cause fungal overgrowth. So taking bath and avoid sharing your personal items like towel sharing or grooming stuff like all of like in the case of tinea capitis, a comb or a soap or all of that should not be shared with other person. This leads to spread of infection to the other person. And apart from that, the clothes which you wear also should be washed properly in a very hot water and sun dried properly. Sun drying is most important for preventing fungal infection for yourself to prevent reinfection, also to spread to the other persons in the family. So drying the clothes in sun and wearing and avoid scratching. And also if there is pets, if they have infection, even preventing infection from pets is also important by avoiding touching directly the lesions if the pet have the lesion. And also the grooming instruments has to be kept clean and hygienic. So these are the
Fair
steps that
enough.
we can follow. Yeah.
Right. So these are the steps that we can follow, especially if you're prone to fungal infection or sweat a lot, are in a humid, environment, then you should be even more careful about it. Now, a very common tendency in our society, doctor, whenever we have any kind of infection on our skin, most importantly, rather than going and taking advice from the correct person, which is a qualified dermatologist, we often go for home remedies, DIYs. And these days, I'm sure you'll also agree with me, because there are so many, influencers on various social media platforms, and skin is one of the, common thing to talk about. Not most of them are dermatologists, but they'll tell us DIYs to do in various conditions, what we can do at home, etc. So, what is your stand on these DIYs, home remedies, applying coconut oil, applying aloe vera, applying turmeric, rather than going to a doctor? Do they really work, or they could be harmful?
Yes, my stand would be that, yeah, definitely don't follow any advice from an unknown person or one who is not qualified to give you that advice, because instead of helping you, it might cause more harm to you. So I advise you to any kind of infection, be it a fungal infection or any skin or a hair disorder, nail disorder, please go to a certified dermatologist and the appropriate physician if you're not able to go to a dermatologist. So they can guide you properly as to what should be done, what should not be done. And taking, instructions from social media is very damaging, and also they can harm you, like they don't know what is the pathology, what is causing it, or something which looks similar can be a different thing which cannot be understood without years of training. So if they consider any rash is a fungal infection and treat accordingly, or any rash to be an allergy and treat accordingly, or tell you apply coconut oil or aloe vera, whatever it is, that cannot treat you, first of all, and sometimes it can cause irritation as well. So I would advise anybody not to follow instructions without knowing what it is, and also go to a proper person to get proper treatment. And timely intervention is very important. Also, delaying these leads to delaying the treatment, because you'll be following so many things thinking that it will help you, but on the long run, it doesn't help you. Then finally, you will have to go to a dermatologist, and that timely intervention is lost, and then you will have issues of resistance, reinfections, or spreading of infection to the other areas or to the family members, which can be avoided if you seek medical attention immediately. So please don't follow. But coconut oil is one thing I would say, it
Right.
does not cause any harm, but you can use it, but as a just a moisturizing effect. It does not do anything to treat the infection. So immediately, if you don't have
Right.
anything,
So
or
it's not going to treat your fungal infection.
yes, so it can help you a bit. Like if you're in a situation where you can't go immediately, 1 or 2 days you can definitely use it, but not anything else.
Right. So the bottom line is, in case you have infection, be it any kind of infection, please go and consult a qualified dermatologist rather than going for these DIYs, home remedies, over-the-counter topical applications, etc. Now, talking about over-the-counter topical applications, it's another very common practice that we in our society do. To go to a nearby chemist shop, ask for anything, and we will keep on using those things. Another problem is, doctor, that initially they work like a magic tube. So we feel that, oh, we have saved on the consultation fee of the doctor, and now I have the perfect solution for it. But later on we realizes that now our skin is addicted to that particular topical application, and by the time we go and land up in front of a doctor, we realizes it's we have wasted a lot of time. So again, how these topical application, over the counter topical application, combination creams, steroid based creams, they impact our infection.
Yeah. So what you mentioned, the magic cream is nothing but a steroid cream. Basically, if you go to a chemist for any kind of infection, they would either give you one of the steroid creams, or it will be a combination creams. And yeah, definitely because of the steroid, it reduces the inflammation in the initial part. So it works like a magic. Your symptoms like itching and irritation would come down like in few days. And then, but you're adding ghee to the fire. It's like that, something like that. So where steroid decreases the local immunity and leads to increase in the infection. So it helps in spreading the infection. So over a long period, if you see like in 1 week or something, you will see the in whatever the initial reduction of the symptoms of burning or irritation had come down. Later on, it becomes more and more severe, and then there'll be more, the lesion would be increasing in size and cause you more symptoms. So this has become a burden to the treating physician as well to the patient, because initially they feel very happy. As you said, they'll think, oh, we have saved a trip to doctor and also the cost of it. And later on, they realize, oh no, it's not working. It's becoming more and more. And also to the physician, it becomes a burden because it leads to treatment resistance. Also, some amount of treatment response to the treatment is very less, or it can take a little longer time to respond to the conventional treatment, or sometimes it cannot respond to that is the treatment resistant. These are the things, the issues that we face after the patient has come after using all this combination or steroid creams. So I would advise them not to use any such creams. Using antifungals as well, because so many of the antifungals that are available, like the what the chemists give, they are already resistant. The fungal infections have developed resistant to such creams. So if you're using it and not getting any results, you think it's not fungal infection, again go back to the steroid creams. And this also leads to the disease burden, and also limits our choices of antifungals that we can also give, because you would have already used so many other antifungals, and it leads to development of resistance, and it limits our choices also.
Right, so resistance is another big problem, and we see a lot of people or a lot of cases of fungal infection these days, and it's also spreading from one body part or one body fold, I should say, to another. Again, recurrence. Like once we had fungal infection, and we are having it again and again and again. So recurrence is another very common issue. What could be the probable cause of it, doctor, that we are seeing so many fungal cases, patients and recurrence, etc., is happening?
Yes, with fungal infection, recurrence is a huge thing that we see. It can happen because of incomplete treatment. If the patient has not completed treatment, it can be a recurrence because they think that superficially, whatever the infection has cleared, the symptoms has reduced within a few weeks of taking treatment. They feel the infection has been cleared from the body. So, but that's not the case. The fungal filaments are there in the body and they can grow back again. So, complete treatment leads to less recurrence rate. So, that is one thing. The patient does not complete the treatment or complete course of the treatment. Another could be environmental factors, like if the patient is staying in a tropical, humid, hot, and temperature where he's constantly being very, he sweats a lot, and he's a sports person and uses a clothing which is like very trapping the moisture like a synthetic clothing, and also he's sitting for a long time like a truck driver or auto driver who sits for a long time in that hot temperature. Those people can have a lot of recurrences because of the environmental factors they are exposed to, and some of the host immunity, like if they have less immunity or and also sometimes in diabetes and such people, it can lead to recurrences. So, but many of the conditions are preventable, even the recurrences, if they complete the treatment and also follow up proper hygienic and the instructions properly, the recurrence also can be reduced. Even in case of a diabetes, if the diabetes is under control or if they're taking the treatment properly, it can be kept under control. So recurrence is another problem, but there are solutions to even recurrences.
Right. So going to the doctor at the first place is one thing, like going to the correct person. Second is trust your doctor and complete your treatment. That's really important. Otherwise, recurrence of fungal infection will be there. Now, doctor, as we are talking about fungal infection, we would also like to know when a patient comes to you with any kind of infection. Maybe as a layman, he or she doesn't know whether it's fungal or not. Uh, how do you diagnose? Is there just the clinical investigation? You can say that, yeah, this is fungal infection, it has spread to this much, or there are various tests that you often conduct.
So basically, with fungal infection, if it's a clear-cut case, if the patient has come as soon as he sees a rash, and then we can easily diagnose it with a visual, normal visual this thing. But there are instances, or it is increasing now, that instances where they've used other creams and also use home remedies or DIY remedies, where the morphology of the lesions tends to change a little bit. So then it will lead to a confusion. So definitely we would go for another further investigation, something called as, we do certain bedside investigations like dermoscopy, and we use another chemical called as KOH, where the skin scrapings are corrected and they are put into a chemical called as KOH, and then we observe under the microscopy. That shows the fungal filaments for us and confirms the diagnosis. So nowadays it's becoming the instances where we have to depend on these investigations are becoming more and more. And also in further, like sometimes they've use extensive creams and over a months of period where the morphology is completely changed and it looks completely like different things, that time we'll have to take biopsy as well. And biopsy is taking a small bit of skin for examination. So we definitely do that in some cases as well. And also, sometimes when the patient is not responding to any kind of treatment, or is having recurrence or reinfections, we'll have to do a fungal culture and sensitivity to know what is susceptibility, and certain other blood investigations to know how long the patient can continue the treatment, or any other like infections he has, and or if like any body issues that he has to consider treatment. So these are the investigations that we do in a patient with fungal infections. But generally, it will be only seeing and diagnosing. But most of the times, we use all dermoscopy, KOH, and other blood investigations. Those are the things.
Right. And what are the treatment options available, doctor?
So, treatment options available, mainly we'll talk about the superficial fungal infections. So, options for superficial fungal infections are both topical and systemics. Nowadays, only topicals, giving only topical is not working. So, we combine topicals and systemics, that is the oral medications that we give. So, topical creams along with the tablets for 3 weeks. And if it is of infections in the scalp or the tinea capitis, we give certain antifungal shampoos. And also, advise certain body soap or body washes containing antifungals. And in to prevent the moisture, like people who stay in a hot and humid conditions, we can also give them antifungal powders to reduce the moisture content in the body folds. And in the nail infections, we advise them to use a nail paint which contains antifungal for a period of 6 months to 1 year, depending on the condition they have. So basically, we tend to treat these conditions with antifungals. It depends whether we can choose topicals and systemic. Most of that, it will be combination of these two. And there are many options like ketoconazole, itraconazole, terbinafine. These are the various medications that we have, and we'll choose according to the patient need and patient condition.
Okay, now talking about nail fungus, because it is again quite common. So, who are the people who are at risk of having nail fungal infection, and how does it look like? And again, as you have already mentioned, the treatment, thing. How much time normally it takes to get better?
Yeah. So nail is again a keratinized tissue and more prone for nail infections by fungus. And people who are more prone are usually diabetes, are immunocompromised patients. They usually get nail infections, or even a normal person if they have any trauma, or they would have used a nail clipper from an infected person or shared their nail clippers. Sometimes that can lead to a spread of infection. And there are many types of nail infections that we can see. It can be white. The main thing is the you see discoloration, that is the change of color of nails. So it can be a whitish color, blackish color, or a certain area of the nails would also break and fall off. Out below the nails, you can see extra growth kind of a thing. These are all the symptoms that you can observe if you have a nail fungus. And basically, nails, we need to, as I told you, completion of treatment is very much necessary to remove fungus from completely from the keratinized tissue. So, in case of skins, it will be few weeks, but whereas in case of nails, it will take months together. Like in fingernails, it grows at the rate of like 6 months for the entire nail to be removed and replaced with a new nail. So, we tend to go give the treatment till that. If it is a toenail, then it takes much more longer. Like it can go up to 10 to 12 months. So we tend to give the treatment that long. It can be, it'll be usually topicals. Sometimes when it is a very, look, all the fingernails are involved and there's a patient need is there, then we give systemic as well for that long.
Fair enough. Now, doctor, we would also like to talk a bit about scalp fungal infection. So, what is scalp fungal infection, and how does it look like? And who are the people again who get it more often?
Okay. A scalp fungal infection, again, it's a, like as such, it is a fungal infection that affects the scalps, or also it can affect the hair as well. So usually it is most commonly seen in children. Uh, there are many organisms which are specifically causing the infection of the scalp. So what can happen is the child or even an adult can also get fungal infections, nothing like that, but more commonly seen in children. And they come with the complaints of patchy hair loss and some amount of white flakiness coming from there, itching, and then there is a brittle hair or the hair becoming very frizzy and looking something different in patchy areas. So these are all the common complaints that we see with the fungal infections of hair. And when and it is used like because of the usage of shared combs, or in the schools where they come in direct contact with these lesions, they can spread easily. But not that everybody is susceptible. It will be only if, like, it depends on many factors like the host factors and the hygienic condition. All of that plays an important role. But since once it happens, these are the symptoms that you can see. And so when the child comes with such complaints, we do certain investigations, check the hair, check the skin of the scalp to know how much the infection has spread, and accordingly we give the treatment with shampoos and oral medications depending on the weight of the child, or depending upon the level of the infection that the child has.
Okay. Now, doctor, many times people confuse scalp fungal infection with dandruff. And a very common obsession in our society is of, putting oil in our scalps. So, especially if we see any dry skin, we'll immediately put a lot of oil on our scalp and stay with it for as long as possible. Is oiling a good option or a good thing to do in case it's a fungal infection?
So, but there's a mixed opinion for this. Sometimes it can help,
Hmm.
sometimes it can increase the fungal infection, because the oil which you use, some of them like olive oil, almond oil, they have factors which can increase the fungus growth. But sometimes coconut oil can limit the condition, or just moisturizing, only that helps. So it's not very clear that whether we can use it or not use it. But I personally say avoid during the infection. Like if you get to know there is a lot of dandruff that you see suddenly in a young child, and who doesn't generally have dandruff, then in such cases just avoid it for during that time. And once if you're confirmed if it is a dandruff or a fungal infection, so if it is a fungal infection, we tell them not to avoid. But if it is a dandruff, I mean, as after the confirmation, he can continue oiling.
Right. Ringworms, or toe fungal, or inside the toes, the fungal infection is again very common. And there is also one associated question from one of our viewer, Tina. Her question is, can sharing shoes spread fungal infection? If you can tell us how to prevent having fungal infection on our foot, especially toes and inside toes, etc. And is sharing shoes spread fungal infection?
Yes, definitely. Sharing shoes with a person who has fungal infection can lead to spread of infection, because shoes are it's a closed environment. Like for your feet, it is closed environment where we sweat. Also, foot has a lot of sweat glands, so we sweat profusely from those areas. Particularly, some people have tendency to sweat even more. So in that condition, definitely the sweat is trapped there, and then it is also a moisty environment. Fungal tends to grow in socks and shoes, and by sharing that, you definitely can get fungal infections. And that way, it should be a long contact with the person. Just wearing it and removing it does not, but if it is a long contact, it can definitely spread. And also how to prevent fungal infections on the foot. Basically, infections that can happen on the foot happens when in a moist environment, like in a walking on a barefoot for a long time at places where it is moist, it is very wet, and that could be a swimming pool, and using some other person's shoes or slippers, and also using the same slippers and shoes without washing it or air drying it, or reducing the moisture content of the shoes, and not washing the socks, and using the same socks that you've worn for a long time. All of this can lead to increased risk of fungal infection. So, in such conditions, yeah, I would advise them to avoid walking barefoot in wet areas, and use slippers in swimming pool, and also don't share your personal items like socks and shoes. And also, socks should be washed every day if possible. Person who sweats a lot should be washed the socks should be washed every day. And also, antifungal, like a person who perspires too much on the feet, can use a antifungal or a moisture wicking powders into the shoes and into the socks. That can help him prevent fungal infection, him or her.
Right. There is a viewer, Ria Sathi, and her question is, can fungi grow on medical devices?
Yeah, as I said, fungus are present everywhere like any other microorganism. They cannot grow on medical devices, but they can be present on that. Only if the conditions, like if there is a moisture, are not cleaned properly, it can grow. But all medical devices are cleaned and they are sterilized, and routine sterilization will be followed, so they cannot have a chance to grow.
Right. Now, doctor, talking about fungal infection of private parts or groin area, can you shed some light over that? Because many a times people, hesitate talking about it and they don't come up. Only when it's get very bad, that's when they go and approach a doctor. So why it is important to come up as soon as they see that something is not normal?
Yeah. So basically, in the groin area, yes, definitely it is embarrassing for many of them to come forward and to seek treatment. They initially think it is because of some irritation, because of use of clothes or long sitting, or because of excessive sweating or walking or running for a long time. But yeah, so since that's the main one of the important places where fungal infections can happen because of the moisture content, as we already discussed. And people who sit for long hours in front of laptop, or also where they are not aeration is not very good, and they're wearing very tight, ill-fitting clothes. These conditions can lead to fungal infections in groin region. So if they don't seek treatment, first it will be mainly itchiness and irritation, and they would sometimes use some other medicated cream. So that will become a problem, because as I explained, if they're using some other cream, diagnosis become difficult, and also treatment later on also becomes difficult. And also, in such cases, you will have lot of uncomfortable, like you will start having itchiness or the sensation, anywhere and everywhere, and that leads to embarrassment. So, and if you don't take treatment properly, there'll be half clearance of the infection, and it can spread from that place to other different places, which can complicate things. So, even though it is embarrassing, but nowadays it's very important to seek treatment faster, so that the infection is cleared faster, and your symptoms, your that uncomfortableness is gone off faster. And that is and as taking few precautions is very important in such conditions.
Okay. Now, doctor, when there is a patient of fungal infection in a family, what are the things that the family members need to take care of or keep in mind so that it doesn't spread to other members?
Yes. So basically, of the family members, first thing is the responsibility lies both on the patient as well as the family members. The patient has such should maintain a hygiene practices where he has to take bath properly, and also his clothes, his towels, his soap should not be shared with the other person. He has to keep all his belongings clean and hygienic, and wash it separately. First thing is that all his towels, clothes that he has worn should be put in a hot water, and then sun dried, and then if we can wash it separately, that'll be great. Putting everything together, like the common this thing is put everything in one tub, or putting everything together in a washing machine.
Washing
So that
machine.
has to, yeah, that has to be avoided, because that can lead to spread of infection. And even the towels has to be sun dried every day, not keeping it on the bed, after you wipe yourself, just keeping it on the bed, that also leads to fungal growth on the bed sheets and this thing. So that can lead to spread of infection. Even combing and whatever the instruments or the articles which come in contact with such areas should be sterilized. For if it cannot be, like it has to be shared, it should be sterilized. If it is not shared, then you can keep it separately. So main thing is clothing, that is the article which comes in contact very easily. So clothing and towels and the soap, the bathing soap should be kept separately.
Doctor, when a woman who's pregnant or who's lactating have fungal infection, how do you treat her?
Yes. So the with pregnancy and lactation, it's quite difficult to treat a fungal infection. So basically, the because of the risk to the fetus as well as the early trimester, the risk of abortions are also there with the antifungals. So we generally stick to. Not all antifungals are not safe. Few of them are safe, like the topical ones. We generally give topicals once, and we give it for a sufficient long period so that the infection is cleared with the topical. And we advise the pregnant or the nursing lady to follow all the hygiene practices, and also continue the treatment for specified period so that the infection is completely cleared, and as well as we tell her to continue for a little longer so that there is no recurrences. But in at certain, like in the last trimester, we generally also give oral antifungal depending upon the level of infection, and depending on the risk of the pregnancy as well. So there are various options, but yeah, there are oral antifungals are usually not preferred in pregnancy and lactation.
Fair enough. We have Anuj with us, one of our viewers, and his question is: do fungal infections show up in the blood test?
No, they don't show up in the blood test. But if the person has a systemic infection, there are certain blood tests that we do, like like that is a very invasive type of fungal infection. But generally, if it is a superficial infection, it does not show up in the blood test, definitely.
Okay. Normally, how much time it takes if we talk about skin related fungal infection, doctor, to heal?
Okay, so if it is a superficial infection, it could be only weeks, like 4 weeks to 6 weeks. If it is a nail infection, it can take a longer, like months together. If it is a systemic infection, it can also take months, and so that's the lengthiest. So these are the various things. So usually, definitely, it will take more than 4 weeks to for the fungal infection to heal in any body part that can happen.
Okay. And Dr. Ramya, before we sum up the whole session, any take home message for our viewers?
Yes, definitely. Any rash, any itching, or any kind of skin infection, hair infection, nail infection, first thing is I would advise you to go to consult a dermatologist and not rate it yourself, or go to a chemist and use a cream. And that is the first take-home message. Another one is taking care of the skin is very important. It is not only the skin health, it is like how you groom. Everything matters in case of fungal infection, like your hygiene and yeah, your daily practices as well, like taking bath and everything. So do to prevent fungal infection is the most important thing in nowadays, yeah, than getting treatment after getting fungal infection. So these are the certain precautions that you can take to prevent fungal infections too. So do follow all of them.
Right. Thank you so very much, Dr. Ramya, for your valuable time. And it has been a very informative session for our viewers. And we really look forward for many more such sessions with you in coming times. Thanks you once again.
Sure. Thank you so much. Yeah,
And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.